In medical news tonight, new research into Alzheimer's disease is getting a lot of attention and raising hopes. A study out today shows testing spinal fluid can be a remarkably accurate way of predicting who will get Alzheimer's. The test sounds promising. Some experts are even calling it a breakthrough. So our Dr. Richard Besser examined it for us.
For many families, not knowing if a loved one is suffering from Alzheimer's disease is a painful struggle.
I wanted someone to say, your mom has Alzheimer's.
New hope of early diagnosis may come from a spinal tap. Research in today's Archives of Neurology says proteins in spinal fluid may be successful in diagnosing Alzheimer's in people with memory loss.
We now have a way of accurately determining whether Alzheimer's disease change is present in the brain of somebody complaining of memory impairment. Makes our ability to diagnose the disease much improved.
A normal brain contains about 100 billion nerve cells, responsible for memories. In Alzheimer's disease, the nerve cells wither and die. Abnormal proteins accumulate and form plaques and tangles. When they looked to see how accurate these proteins were at predicting illness, they found 90% of those with Alzheimer's had the disease pattern in their spinal fluid. These proteins are a focus not only of diagnostic research, but in developing treatments, and one day a cure for the 5 million Americans suffering from Alzheimer's.
We now have a tool that allows us to identify the disease years before dementia starts, and that's the stage of disease at which intervention should be effective. It's treating the Alzheimer's disease process before there's irreversible damage to the brain. I think that's the key to bringing this epidemic of Alzheimer's under control.
It will still be a few years before the spinal fluid test is available in your doctor's office. For now, it's driving new research. I asked if we would see a cure or effective treatment in our lifetime. The answer I got, George, absolutely.
Okay, well, that is hopeful news. Rich Besser, thanks very much.